Through the pandemic, Telemental health, behavioral health services delivered telepsychiatry, has become really the most used venue for telehealth. And it's improved people's adherence to some programs and medications and so on.
Hey gang, it's Tuesday, June 15th. Lisa and listeners, welcome to the Behind the Numbers Daily, an eMarketer podcast made possible by VTEX. I'm Marcus. Today I'm joined by our principal analyst covering healthcare, is Lisa Phillips.
Hi Marcus, thanks for having me. Happy to be here.
Thank you so much for joining. Yeah, thank you so much for hanging out with us. Today's fact, before we start the episode, Venus is the only planet in the solar system that spins backwards, rotating in the opposite direction than the Earth rotates, which means that on Venus, the sun rises in the west and sets in the east. On July 20th, Amazon founder and richest person in the world, Jeff Bezos, is going to space on the first crewed flight on a rocket made by his space company, Blue Origin. Lisa, would you go to space if I could get you a ticket?
Not with Jeff Bezos, but I want to say about the Venus thing, maybe we're all spinning the wrong way and they're doing it right. They're going in the right direction.
Oh yeah, I hadn't thought about that.
We have a bias
they're doing it wrong
based on our Earth.
I know. Venus are probably talking about the same thing. They're like, Earth spins backwards. We don't. We spin the right way. I wouldn't. Yeah, I'm with you. I don't think I'd go, even if I could get a ticket on a NASA aircraft. I've seen Armageddon. There's no way. I've seen Armageddon. I'm not going to space. Forget that. Anyway, today's real topic. Where are we at with telehealth? Telehealth is when you use electronic information and telecommunications technologies to provide care when you and the doctor are not in the same place at the same time. So video chatting with your physician would be one such example. Using mobile health apps would be another. The pandemic made telehealth all the more popular for obvious reasons. Global health experts ranked telehealth the number one area they thought would benefit the most from COVID-19, according to research to guidance, more so the remote monitoring, self-testing, or digital pharmacies. So a couple of examples of how it's exploded, to be perfectly frank. Kim Hart of Axios gives one example in Ohio, where Cincinnati Children's Hospital Medical Center and CEO Michael Fisher said that in an interview with McKinsey that the hospital system went from 2,000 telehealth visits in all of 2019 to over 5,000 a week in July 2020. And the second one here, the number of telehealth medical claims grew 31-fold nationally from October 2019 to October 2020, according to Fair Health's regional tracker. Lisa, what do you make of the adoption of telemedicine in the US, let's say over the last few years?
Well, according to insider intelligence estimates in 2019, between 2019 and 2020, telehealth use rose almost 99%. So that bears out your numbers. In 2020, there were we estimate anyway, that there were about 42 million US adults that used telehealth during the pandemic. And obviously that was of necessity. People were locked down. There was no other way to reach a doctor or talk to one. However, that caused an awful lot of practices to have to scramble and put telehealth in place, practices in place. And a lot of that adoption was helped because the Centers for Medicare and Medicaid Services, which we call CMS, put out a whole bunch of emergency measures starting right in mid-March of 2020. And that opened the floodgates so that physicians could talk across state lines and so on, which had been forbidden before.
Yeah, it seems as though folks are going to continue to use it. 6 out of 10 folks said they're more likely to use telehealth services now than before the onset of the pandemic. That's from March 2020 survey by Sage Growth Partners and Black Book Market Research. We estimate that 18%, let's say 1 in 5 Americans using telemedicine today, 1 in 4 using it by 2024. We mentioned Michael Fisher, who is the CEO of that Cincinnati Children's Hospital Medical Center. He was saying that telehealth could make up 30% of all healthcare visits in the future. Lisa, what is telehealth's ceiling, in your opinion?
Well, we have yet to see. I mean, as you just said, by 2024, Insider Intelligence does expect there's 26% of the population will use it. That doesn't mean 26% will be happy with it. Just like, just like a lot of people weren't happy with what they had to deal with in June of last year, just to say, when they had to have a telehealth visit. But it's going to be more and more required by healthcare providers, payers, especially the insurance companies, are putting out plans even now where your first visit is going to have to be with a chatbot, maybe. And then the chatbot will triage what you need and send you to the proper channel. It might be a nurse practitioner, not your doctor. So I think that's the future of it. I do not know how many people would sign up for that plan.
Yeah, it seems like there are a lot of different use cases, a lot of different scenarios for this. So you mentioned that triaging platform. Yeah, a new AI system. There's one from Demand Privacy Care Company 98.6 that can triage patients using voice and image recognition. So people would interface with an AI before a human doctor. What other kinds of scenarios are people using telemedicine for? I mean, most people would think of the video chat with a doctor when you're talking to them about something that's bothering you. Aside from triage and virtual appointments through the phone, how else would people use telemedicine and telehealth?
Well, the one I find quirkiest is teledentistry, but but
okay.
that actually is a thing. It was introduced by Henry Schein, a big dental services company, back last year. But through the pandemic, Telemental health, behavioral health services delivered telepsychiatry, has become really the most used venue for telehealth. And it's improved people's adherence to some programs and medications and so on. So
yeah, I was actually speaking to my dentist recently, and I was asking him how much telehealth they use, and he was saying now not so much, but he was saying that there were a lot of occasions he has patients taking photos of their mouth and sending them to him, and we were kind of laughing about it, but he was saying actually it's quite helpful, especially if the person can't get in, if the person has some mobility issues, maybe they live far away, maybe they've just got to take care of the kids or whatever. So yeah, I could see that definitely catching on, even though again you're going to need to see people in person for a lot of different things. Yeah, as you mentioned, you can see people to diagnose things, you can see people virtually to give them results, perhaps therapy sessions as well. It's interesting because when we were talking about this before the recording, you were saying that telemental health is something that's going to be really driving this forward quite a lot. Miss Erim Ahmed, who's Insider Intelligence health research analyst, she was noting that conditions like blood pressure only made up 2% of telehealth claims in February 2021. Meanwhile, mental health conditions made up half of claims in February, according to Fair Health data. One such example of this was in May, Doctor on Demand. They had a new chat-based mental health coaching service, which could bring in a new group of folks into the fold, as opposed to having to do full-blown therapy sessions, being able to just interact back and forth through messaging app. When you say Telemental, what types of services do you see driving that space? Sort
of what you just mentioned, more maybe not necessarily whole virtual sessions, but definitely the chat-based things, just checking in, saying, I have a problem, or I'm having issues, whatever. All of this has to be HIPAA compliant, though, too. And so that's a key point to make. But yeah, the mental health conditions, I think, will continue to dominate. But there's also, besides the mental, there's other behavioral health things for children with autism and providing autism services through this. Children still can't be vaccinated at this point. So some who have conditions may need to, continue doing things like having sessions that way. Yeah. You mentioned things being HIPAA compliant. I'm wondering what might be holding telehealth services back. One obvious one, I guess, would be the fact that it might feel a bit impersonal. You want speaking to your doctor, you're losing some of that emotional connection, perhaps, especially if it's someone you've met for the first time as opposed to a doctor you go back to often. What other kinds of things are holding telehealth back? Probably people's experiences that they already had with it. I think. Oh, really? I know somebody who had an annual physical via telehealth visits last year, and he just said it was a joke. Really? I don't know how he even did a blood test, but he just said it was, definitely wasn't any experience he wanted to have again.
Is that what you're seeing from a lot of the, either anecdotally or from some of the research, people's experiences with telehealth? Is it that by and large they're kind of a bit turned off by it, or by and large they've had relatively positive experience?
I'd say it's 50-50.
Okay.
Some younger people who, they don't want to do appointments, that's, telehealth for them is perfect. Love it. Most of them don't have chronic conditions that would require regular check-ins. So yeah, just drop in, primary care visit, this is my temperature. I mean, there are all kinds of sensors out there now and home diagnostic tests that people can use, and they've gotten a lot more comfortable using them. That said, older people who are vaccinated would rather go back to the doctor, I think, unless they have true mobility issues or they live, like I say, transportation or things like that.
Yeah. Yeah. Older folks, less comfortable with using virtual tools in general, but particularly when it comes to interacting with doctors. There was some research we saw from Ipsos, and they were asking folks if both were safe, what activities would you rather do in person versus virtually? And the number one activity people wanted to rush back in person for was doctor's visits. I think it was 76% in person to 18% virtual, more so than any other activity, shopping, going to the movies, etc., etc. Yeah, so older folks, also other groups of people who may struggle with these types of services, lower income folks, less likely to have reliable internet services to make virtual visits possible. You mentioned chronic conditions. The COVID-19 Healthcare Coalition found that most people are using telehealth services for chronic care, high blood pressure, diabetes, some for preventative care and acute care, and a fraction for emergency care. Could you see that changing? Could you see a case where emergency care gets a share? If you're having a problem at home and you can dial into an operator and they can see what's going on through the camera, perhaps not as a replacement, but as a way to getting you better information quickly as the emergency services arrive?
Well, yeah, that may become mandatory for people who have United Health Group insurance, because just this week they came out with an edict that said we may retroactively deny your claim if you go to the emergency department for a sore throat or something that is non-emergent. Yeah, if you're on a plan like that, you would be checking in first, to find out, do I go to the emergency room because I can get a ride there, the bus goes there, rather than a few blocks further to an urgent care.
Right. Circling back to really quickly that we're talking about older folks and minorities as well. Research in the American Journal of Managed Care showing video visits were lower among lower income, Black, Hispanic, older and Spanish-speaking patients during COVID-19. So some research to back that up. Also privacy concerns, and maybe not even just people, hacking your data, but also just privacy concerns because you're talking about very personal issues. You're not just walking around doing like banking or trying to make a dinner reservation. You're talking about very personal things. You have to try and find, for a lot of things, I would imagine, a quiet space, private space.
Although I will say that Alexa is HIPAA compliant and can be. A lot of hospitals have, instead of having a nurse go into a room where somebody has a severe case of COVID in the ICU, they've worked out programs with Alexa where they can just have that device in there. People who, at certain health systems who have worked with Alexa and Amazon, they can just say to Alexa, and back to your point about diabetes, there are an awful lot of very good advanced remote patient monitoring devices for diabetes that feed information constantly to your health system or your physician. And you can just ask Alexa, what was my glucose reading yesterday at noon or something? And privacy concerns are being addressed, but the problem with that is that HIPAA was passed in 1996 and is way out of date at this point for all the devices we have.
Aside from the pandemic, what's driving telehealth? Are there other things you can point to say, it's this, and it's that? Follow
the money. That's always what I tell everybody. What's driving it is that it's bringing down the cost of healthcare for, as I say, cutting out a lot of emergency visits, cutting even unnecessary doctor's appointments, trips to doctors. It can increase productivity. Those not costs that people can figure in, but it's really going to be the new normal for healthcare delivery.
Yeah. Yeah, when I was speaking to my dentist, one of the things he was saying is, yeah, it'd be great if between 2 o'clock and 3 o'clock I could just have back-to-back telehealth appointments. It would be much more efficient and would give me a lot more time in the day to spend longer than 5 minutes eating lunch. I'm sure there are a lot of healthcare providers who would feel that way. You talked about follow the money. At the start of May, Walmart said they were buying telehealth provider MeMD with the intention of offering nationwide virtual healthcare services, reporting by Sarah Nassauer and Rolf Winkler of the Wall Street Journal. Why? Why does this make sense, Lisa, for Walmart, a retail giant, to be buying a telehealth provider?
Well, a few years ago, they started with their freestanding clinics, Walmart Health. And those clinics were in areas like Dallas, Georgia, which I have been to. And you could walk in and there were prices on a board, that could change, but would say, okay, you could get a behavioral health care visit for $40 an hour. You could get a primary care visit. You could visit a dentist, get those services. And they had planned to roll those out all across the country in certain markets, and they started. But a brick and mortar healthcare provider is not as cheap as having a telehealth version. And to the point that, yes, and also Amazon had just announced that it was going to offer its own virtual telehealth program to self-funded employers across the country in all 50 states. And they are really ramping up. They've already signed, according to the Wall Street Journal, they've signed several clients already. They did announce one back in May, but they say they're going to announce the rest of more by the end of the summer. Walmart seeing that and saying, we've got to compete.
Right. Google-backed Amwell, the company that provides telehealth solutions for patients and doctors, just went public in September. As I mentioned her before, Insider Intelligence digital health research analyst Eram Ahmed notes that the company's growth has slowed right on down from 34% year-on-year growth in Q4 to just 7% year-on-year growth in Q1. Nonprofit Fair Health notes that telehealth adoption for primary care fell 16% from January 2021 to February. We talked a bit about where adoption of telehealth is going to be going by 2024, 1 in 4 people up from 1 in 5 today. But in the short term, Lisa, how much of a slowdown do you expect to see in telehealth visits as the pandemic eases, or it has already eased somewhat and also will continue to ease, hopefully in the coming months?
It could drop off by half. I estimate that's my guess.
Okay.
The other part of the follow the money is that CMS opened up reimbursement, channels. Just said, yes, you can deliver telehealth anywhere. Before the pandemic, for Medicare beneficiaries, they had to be in a designated rural area, and in order to get a telehealth visit, they had to go to a hospital or a clinic in order to get a telehealth visit with, a specialist in a city somewhere else.
Got it.
So that's how limiting it was for at least Medicare beneficiaries. Then CMS said in mid-March of last year, okay, all bets are off, we'll reimburse for these visits. That has not become permanent. There's now several bills in state legislatures. There's a bill that was just introduced into the Senate yesterday to make some of these COVID telehealth changes permanent. But we'll see. The whole payment scheme is uncertain going forward.
Unfortunately, that's all we've got time for the first half of the show. It's time now for the halftime reports, where we summarize the key takeaways from a lead story in 30 seconds or less. So, Lisa, what is your main takeaway from the first half? What 1 or 2 things do you think people need to take away with them today?
Well, the telehealth is here to stay. It's not going to go away, but it will change the way healthcare is delivered in the United States as far as primary care goes, and maybe even emergency care.
Terrific. That's all we've got time for the lead story. Time now for In Other News. Before that, we say goodbye to Lisa for this part of the show. Thank you so much, Lisa, for joining us.
Thank you, Marcus. It's been fun.
Yes, it has indeed. Time now for In Other News, but first a quick word from our sponsor, VTEX. Retail's next competitive threat may come from a business model or channel that didn't even exist a few months ago. This modern dynamic requires companies to adapt quickly, pivoting business seemingly overnight, something traditional commerce platforms just can't support. There's a new enterprise commerce platform on the rise, one that's fast, flexible, and doesn't require 9 months and $1 million to get up and running. Go to vtex.com/emarketer to learn more. All right, folks, we are back. Joining us for In Other News today, we have one of our directors of forecasting. It's Cindy Liu.
Hi, Marcus.
Hey, Cindy, thanks for joining us for the second half. Today in Other News, how many folks in America use buy now, pay later services? Why some retailers are looking to expand their brick and mortar presence going forward? And Walmart and Amazon add prescription discounts to their respective membership programs. Story 1. Buy now, pay later, or BNPL lets folks pay for their purchases in bite-sized pieces, say weekly or monthly payments, often with no interest or fees. BNPL is sometimes known as point-of-sale lending. BNPL providers like Afterpay make sure merchants get paid the full cost of the item immediately. They then take on the risk of securing the repayments from customers. Merchants do have to pay around 2 to 8% per transaction, typically higher than credit card fees, or a flat fee, say 30 cents per transaction. ACI Worldwide notes that 3% of global e-commerce spending will be through BNPL services. Cindy, we have a new BNPL forecast of US users. What are we showing?
Right. So our very own Oscar Orozco just developed these forecasts, and
The infamous.
He is forecasting that about over 45 million people in the US will use a buy now, pay later service. And that, can include Klarna, Affirm, Afterpay are some of the big players. And he noted like some of the key drivers are younger consumers who, want more flexible payment options. And also it attracts, people who have reservations about using credit cards and the high interest rates that they can occur through them.
Mm-hmm. Yeah, really just an explosion of this service. 2019, 4% of people using it. Today, 16%. So from 4 to 16 in the last 2 years, climbing to 21% next year, 24% the year after that. Some other research on BNPL, 85% of people who have used BNPL plan to continue doing so. In the Straw Hacker group, 48% of consumers, just under half surveyed, wouldn't buy from someone who didn't offer BNPL. It's from thought leadership site payments.com. And 42% of Gen Z, 69% of millennial shoppers are more likely to purchase items if a BNPL service is offered. That one is from Afterpay. Cindy, it was also interesting. BNPL is a popular online form of payment, but its usage in-store is growing as well, from what I was reading. Have you heard about that? And what would in-store look like?
Yeah, I mean, I don't necessarily know how it would work, like logistically, like if you're pulling out your phone or like how that works, if it's like a physical card. But I mean, on the merchant side, there's obviously a lot of upside as well to using and partnering with one of these services. As you said, like they get paid the full amount up front. They don't take on any risk. And then they also have the ability to, drive more sales among consumers,
right,
who otherwise wouldn't have purchased that item.
Yeah, the in-person is interesting because when you're online, you can see what the breakdown of payments is over what amount of time, but maybe that comes up on the screen when you're at the cashier, in front of the cashier. And I guess if you paid by credit cards, then it could say, hey, yeah, we're gonna take this much today and this much over the next couple of weeks or so.
And one thing, actually, now that you mention it, mentally, I feel like if you see a dollar amount broken up into 4 smaller payments, that's just mentally different than seeing like the full amount too.
Yep. Absolutely. It's going to translate in store as well as online. Story 2. Last year, a record 15,000 stores closed, according to Cushman and Wakefield, led by Ascena, Ann Taylor's parent, and Inditex, Zara's owner. Despite that, plenty of retailers are looking at 2021 as an opportunity to expand their brick and mortar presence. American Eagle is aiming to open around 60 Aerie stores in 2021. Warby Parker just announced 35 new locations set for this year. Even Gap, which was scaling back its physical presence, plans to open more Old Navy and Athleta stores, notes Richard Collins of Adweek. Heck, even Google just opened their first physical store in New York City's Chelsea neighborhood, down there on 15th and 9th. Cindy, companies looking to expand their brick and mortar presence this year and beyond. Why?
Yeah, it sounds a little counterintuitive, but, as a retailer, like if you already had store expansion plans like before the pandemic, then this is probably the best time to do it now, especially last year with so many store closures. The real estate market, you could probably get a really great deal, so now is probably the best time to do it. And I'm not surprised to see a lot of retailers, accelerating their store openings.
Yeah.
The other thing that's interesting here is also that, a lot of D2C brands. So, thinking back even prior to the pandemic, we saw a lot of D2C brands moving beyond their, online only operations. So a lot of them were opening up stores, opening up pop-up locations, partnering with retailers. And a lot of that was because, they found that it cost a lot to acquire new customers online, whether that's marketing and buying ads on social, but that eventually is costly. And the best way to increase your customer base is also to provide a physical store presence. So it lowers customer acquisition costs, but then also, you can also develop deeper relationships with your customers. And so before the pandemic, we saw a lot of D2C brands opening up stores. And so now, again, this is a great time for them to continue that.
Yeah, great point. Story 3. Walmart and Amazon have both just added prescription discounts to their respective membership programs, notes Nicolette Accardi of NJ.com. You were pointing the story out to me, Cindy. Walmart Plus members can now access a prescription savings program called Walmart Plus RX for Less, where they'll unlock exclusive savings on thousands of commonly prescribed medications, as the company says, ranging from 0 cost to 85% off, with an average saving apparently of 65%. Members simply present their pharmacy savings card and a valid prescription at any Walmart pharmacy location. A day later, Amazon started offering prescriptions to Prime members at $1 a month for a 6-month supply. You heard me right, $1 a month for a 6-month supply, so $6 over the course of the 6 months, according to Retail Dive. Cindy, what do you make of these moves?
Yeah, so the retail pharmacy market right now is like the next big battleground.
It's on fire.
It's a $360 billion market and will continue to grow as our population ages. And so, Walmart and Amazon are both, aggressively pursuing it. The interesting thing here is that Walmart, is adding these perks again, also to their new Walmart Plus subscription program. So that's one draw to also increase their members, increase people who subscribe to that program. And then also, they're directly competing with Amazon too. But then again, you also have to think about the traditional pharmacy retailers like CVS and Walgreens. And in fact, I feel like those retailers perhaps are probably the most threatened by these moves.
Indeed. That's all we've got time for this episode. Thank you so much to my guest. Thank you to Cindy.
Thank you.
Huge thank you to Lisa, who joined us for the first half of the show. Thank you to Victoria. She edits the show. Thanks to everyone listening. Nicole Perrin will see you tomorrow for the Behind the Numbers ad platform, an eMarketer podcast made possible by Vtex, where she'll be speaking with Melissa Burdick, co-founder and president at retail media buying technology firm Packview.